In this video, I'm going to answer the question, what triggers sciatic nerve pain? And at the end of the video, I'm going to provide some resources for you, which are going to help get you out of trouble so that you and your family can get back to doing the things that you love. My name is Dr. Craig Heinsohn from Loving Life Chiropractic in Ottawa. And today we're going to discuss the three groups of things that trigger sciatic nerve pain. One is spinal, one is non-spinal, and the third is iatrogenic or medical. To fully understand the discussion, I'm going to cover a little bit of anatomy. And to help me out, I've got my willing volunteer, Harvey. So the sciatic nerve, and we cover this in more detail in the video, Where is the Sciatic Nerve? But the sciatic nerve is basically the brain extends down into the body as the spinal cord through the armored tube that we call the spine. And at the bottom two levels of the spine, two nerves come out, as well as three nerves from the tailbone, and they blend together and they make a large nerve that's about the width of your little finger. And that goes from within the pelvic bone. It actually exits out of the back of the pelvic bone and then travels down the rear of the leg. It then splits into two and goes to the foot and muscles in the back of the leg. That nerve is called the sciatic nerve. Okay, now if we look here on this model, and this is the model of the bony armored tube, or the spine, commonly called the spine. So if you look at the base of the spine, you have spinal bones that support the weight of the body, and in between each bone there is a disc. The disc is actually a spacer. It's filled with fluid. It's not designed to support a lot of weight. The curves in the spine make a spring. They are designed to support a lot of weight. But if we go to the back of the spacer, there's a hole, and out of the hole, if you can see it, there's a yellow bundle. In this case, it's cut short, but in most cases, it will actually continue out. In fact, not in most cases, in all cases, it will continue out. In the case of the sciatic nerve, these nerves come out, they join together, they come through this hole at the back, and then down the leg. Now, if there is a restriction or an interference in the nerve system around here, there can now be faulty signals going to the muscles. That means that the muscles go into spasm and start to hold the structure in a weird and wonderful way. Obviously, we still carry on through life, but over a period of time, the disc starts to flatten. As the disc flattens, because it doesn't have the motion it should have, this in turn closes the size of that hole, and in turn we start to get pressure on the nerves. Now with the sciatic nerve, because it's so long, there are various areas that can be compressed. As a chiropractor, I look to remove restrictions on the nerve system, interference on the nerve system, to get that area moving correctly. So for me, nerve interference is one of those triggers, which actually runs through all of those three groups I mentioned earlier. There are basically three main spinal causes. The first one I've just discussed there could be nerve interference, called a subluxation in chiro speak. The second can be what's called stenosis. This can often be as a result of the spine not moving properly. Stenosis just means narrowing. So there are two places that the channel in the spine can narrow. One is in the hole as the nerve comes out of the spine, and the other is actually within the spine. There is a hole all the way through the spine. Now, narrowing happens for lots of different reasons. One of them is restricted motion, but there can be other reasons as well. The second is something called spondylolisthesis. Again, this is a fancy name, and what it basically means is that this vertebral bone is moving forward. Instead of being in the place it's meant to, it's moved forward. And if you imagine the cord running down through the hole in the rear of the spinal bone, as that bone moves forward, it's going to put pressure on that cord. So that is why spinal listhesis, or we could call it vertebral slip, forward vertebral slip, can cause pressure on the nerves. And in turn, if it's down here, it can start to stretch nerves within the spine, which in turn can cause irritation and cause a trigger to the sciatic nerve pain. And the third reason is lumbar radiculopathy, which is where the nerves coming out of the lumbar spine are affected in a disease state, so then the nerves start to break down. Again, some people say that subluxation, restriction of motion can lead to that sort of problem. Non-spinal causes of sciatic nerve pain include things like piriformis muscle spasms. Piriformis is a muscle that crosses the inside of the pelvis. It also crosses the sciatic nerve. So if it goes into spasm, it can put pressure on the sciatic nerve. At the end of this video, there'll be another video which gives you the 4 best sciatic nerve pain release stretches. That's the muscle that's actually being released. Okay, so another thing, non-spinal cause, is pregnancy. During pregnancy, the ligaments tighten up and the joints of the pelvis become very flexible, obviously in preparation for the birth of baby. So that can lead to interference with the sciatic nerve. That's why a lot of pregnant mums either get sciatica, or in some cases, after they've had sciatica for years, it can go away when they're pregnant because these joints reposition themselves. And if you have trauma to the leg, that of course can cause interference with the sciatic nerve. And then finally, pelvic or sciatic nerve tumours can cause sciatic nerve pain and trigger sciatic nerve pain. So that's for non-spinal causes. And then the last group of causes we talked about was atrogenic or medical based causes of sciatic nerve pain. And these sorts of things can be intramuscular injection. There's a lot of evidence showing that injections in the buttocks, if they're not done correctly, can lead to sciatic nerve pain, and hip replacements as well. Okay, so I hope that's been of use and of interest and help answer some of your questions, such as what triggers sciatic nerve pain. So if you've enjoyed this video, then go down below, smash the like button, share it with some friends, especially if you've got friends or loved ones suffering with these sorts of issues. And if you're enjoying the value you're getting from videos on this channel, well, smash the subscribe button. And I look forward to serving you and providing plenty of value so that you and your family can live healthier lives, do what you love for longer. So if you have any comments, write them down below, and I would love to make a video for you, or at the very least answer your questions to the very best of my ability. My name is Dr. Craig Heinz of Love and Life Chiropractic. Thank you.